So infertility based on Western medicine, just to look at it from an age standpoint, if you're a female under 35 years old, you would be considered having infertility problems if you have been actively trying for a year and have not conceived. If you're over 35 years old, it would be actively trying for 6 months and not conceiving. Mm-hmm. And then also in that category is recurrent miscarriages or not being able to retain a pregnancy. So, in the United States right now, it's quite amazing. 9 million people are having trouble conceiving. And it could be either you or someone you know. The chances of that happening is 1 in 8. So statistically, when you're looking at, how much of this is a female factor, how much of this is a male factor, how much of this is unexplained, the statistics show that 35 to 45% of all cases are due to female fertility problems. 15 to 35% are due to male, and 15 to 25% are due to a combination of male and female issues. So the female might have an issue with growing follicles or implantation. The male might have an issue with their sperm quality, the way it moves, or the amount he has. And then 10 to 20% of all cases are identified as unexplained. So they really aren't finding an answer as to why these two people can't become pregnant. That the female's healthy, the male is healthy, there's just no answer. And that is a lot of times when people might move on to acupuncture, Chinese herbs, assisted reproductive technology like artificial insemination and Vitro fertilization. I've seen many patients get pregnant with acupuncture and herbs alone, but many times we have to combine with Western medications. Sometimes it's as simple as they need some progesterone to start their cycle so that we can get their cycles back on track. Sometimes they may have to go farther because they aren't ovulating, and we can do treatments to help trigger ovulation, but sometimes their body needs a little push. The really exciting thing about going through acupuncture combined with Western medicine or alone and getting pregnant that way is many times after one pregnancy, the body kind of figures it out. And then once the couple wants to try again, if they do, a lot of my patients have gotten pregnant on their own. So just that whole working with the body, balancing it, and then the body knowing, oh, that's what I was supposed to do. Okay, let's do that again. And it works out great. There's a really great case study for that one. A patient who, really nothing wrong with either of them, nothing that could be found. Perfect body type, perfect, situation to get pregnant, under a lot of stress because fertility can be an incredibly stressful thing to deal with. However, she did go in and get a little bit of endometriosis removed, which sometimes the littlest bit can cause a problem. But as her doctor was looking around, she saw the vein supplied to her ovaries. And she goes, wow, those veins are really, really small, but they're pumping quite hard. And my patient said, I just came from acupuncture. She goes, oh, that makes sense. So finally, through a few rounds of assisted reproductive technology, we had to do IVF, so in vitro fertilization, and then combined with acupuncture, and then also doing a before and after treatment, it can be very, very successful. So a lot of times these success rates go from 20% to 60 to 70 when you're combining acupuncture and Chinese medicine. So she got pregnant, had a happy, healthy boy up on the board. Talked to her, just checking in, more recently, a few months ago, and she goes, I think I'm ready to, try again. Well, I hadn't heard from her in a few months, so I just checked in again, and she said, I'm pregnant. And the whole time, we were kind of like, must have been, maybe the vein supply, because, we just thought they're tiny, and but you did it. She did it, and she couldn't be happier. And her pregnancy is going fantastic, and we're still doing supportive treatment to help through the pregnancy, which can also make the labor a lot easier.
Sure. That's a beautiful story. If it can end in success, that's all anybody can ask for, right? Absolutely.
So acupuncture can help on so many levels with many of these issues. Polycystic ovarian syndrome, we can help with getting more circulation, more supply to the ovaries, and helping to hopefully decrease the size of the cysts that are on the ovaries. And the cysts can sometimes emit a hormone, which again, when one hormone is off, they all kind of get thrown off. Luteal phase defect, when you're looking at studies, the group that had acupuncture and the group that didn't have acupuncture, the success rate actually doubled with the acupuncture group, as far as, I don't want to say fixing that, but as far as making that happen the way it should. So luteal phase is the second half of your cycle after you ovulate, and it's when your body creates progesterone. And the progesterone is what helps you hold a baby in. So people who have recurrent miscarriages often have a part of what this luteal phase defect is. Now, I'm not a medical doctor. I can't diagnose or say that's what you have. I'm just giving you a definition. But if you do have lower progesterone, that can definitely cause an issue where you might not be able to retain the baby and have recurrent miscarriages. So by balancing the body, we are in a sense balancing the hormones, the entire body, which helps with that issue. Again, are there times we have to have progesterone from Western pharmaceuticals as well? Absolutely. Just depends on the situation, depends on the person. Unfortunately, a person will have to go through 3 miscarriages before they kind of look into why the person is having the miscarriages. So again, not only is it as important to be a whole body treatment instead of just singling in on a certain issue, but being a support system for that patient is just huge. Imagine having to have 3 miscarriages before you can find out what is happening is very difficult, and sometimes it's just happens and it has nothing to do with anything the patient did, but as humans we have a tendency to just go there. And so it's really being supportive and hanging in there and talking about how we can best make this happen and best make this possible. We can work on poor blood flow to the uterus, we can work on fibroids, we can work on polyps, ovulation, blocked fallopian tubes. Acupuncture is a slower medicine, which does work on scar tissue. However, when we're trying to get a patient pregnant, we have to look at what's the safest route, what's the best route, and what's going to be the most optimal route to get them to their goal as quickly as possible.
Sure, definitely.
So sometimes it's not the female at all, where she's not having a problem with creating follicles, the follicles going down the tubes are cleared, they make sure of that, they've been checked out where they don't have endometriosis, they don't have signs of cysts or polyps, and all of that has been ruled out. So oftentimes fertility clinics, which is a good thing, and OBGYNs, if there's some unexplained fertility going on, will do a semen analysis. And a semen analysis can show several things. For males, motility, morphology, and sperm count. Motility is the way it swims, morphology is the shape of the sperm, and then count is the count.
Okay.
The average male sperm count dropped 45% between 1940 and 1990. And a lot of that's caused by, environmental exposure to recreational drugs, exposure to medications, also smoking. Smoking has shown that that can significantly lower counts and create abnormal sperm. And they've shown studies where after quitting smoking for the males, after 6 to 12 months, it significantly improves. And then, of course, not just with male factor fertility and female factor fertility, sometimes you just have to look at, is this female's body working to get pregnant with this male's body? We find our partner, we get married, but that's not saying that all the times it's going to be that easy where you'll immediately get pregnant. Again, a lot of that is unexplained infertility, and either it takes a long time to find out why it is explained infertility, or eventually we will get to our goal, and it just takes a little bit to get the body balanced.
Sure. Those are powerful statistics that you shared, Jen. Thank you for sharing with us.
And, we like to plant in people's heads, allow at least 3 months of once a week of treatments to get the body balanced and prepared to carry a baby, and also to help with the sperm count, morphology, and motility. Now, when you're looking at how long it takes to make a follicle into egg status and so that it's ready to go, that actually is 150 days. So when we say 3 months, it can be 3 to 6, but I've seen people get pregnant within a month. I've seen people get pregnant within 6 months. It all depends on what we're dealing with, what the diagnosis is, and what other things we're having to work with. If we have to combine it with Western medicine, if we aren't, if there are other things affecting the issue, especially endometriosis, which is unfortunately one of those things that can't be found unless they actually are laparoscopically go in and look to see. Okay. And even the tiniest bit of that can cause a problem.
How quickly do you recommend people come see you?
Oh, as soon as possible. I mean, honestly, the sooner the better, because acupuncture is kind of a slower medicine.
Okay.
It's not like taking, for example, an ibuprofen and in 15 minutes you're getting pain relief. It's a very cumulative effect. So each time you get a treatment, we're getting the body better. Now, fertility is a little different when you're treating that, because there's also different treatments for each week of your cycle, different treatments based on the first half of your cycle versus the second half of your cycle, different treatments as far as if you're not ovulating properly, different treatments as far as if your FSH level is higher. So there are many other things we look at that help us with diagnosis, and fortunately it does come from Western medicine sometimes. Basal body temperature graphs, for example, we can look at, and even though it's telling us this is when they're ovulating, this is when they're getting their period, based on the way the graph looks also helps us diagnose, and we can relate that to our Chinese medicine diagnosis terms. So there's many things we can do, and the sooner the better. What I do with my patients is I work with them, and if there are herbs that I think they should have, I definitely make sure that after ovulation they are completely safe to get pregnant on. Before ovulation, usually completely safe too, unless we need something that, for example, we're going to work with polycystic ovarian syndrome and work with the ovaries, then that might be an herb you take day 1 to ovulation, so it's not interfering with the second half of the cycle. So a lot of things to consider there, but essentially the sooner the better, because it's just getting your stress down alone is going to up your chances so significantly.
I love that.
And also as a cost point, because I know a lot of people are concerned with cost, looking at, most people go through 7 rounds of assisted reproductive technology before they get pregnant. Just on that alone, that's a huge expense. And if we can get you pregnant on 2 rounds of assisted reproductive technology while combining acupuncture and or herbs, you are going to be saving a lot of money. You're going to be balancing your body, your entire body, so you're going to get the benefit of us not working only on the fertility aspect, but do you have allergies? Do you have insomnia? Do you have a sore neck? Do you have frequent urination? Do you have an old injury that is really revving up and you can't walk on your ankle very well because you sprained it 10 years ago? Do you have an autoimmune issue or chronic inflammation? All of those things can be worked with acupuncture.
Sure.
So essentially in one treatment, although it's very honed in to your fertility issue, we're still going to touch on all those points.
That's great. That's great. Thank you. That explains a lot.
In TCM, there's never a bad cycle. We're constantly working to keep you calm, to keep your anxiety down, to keep your nervous system balanced, to keep more blood flow going to the uterus and to your organs. Blood circulation is key, not only to get to your organs and uterus, but to also flush out the excess cortisol and things that might be in there that's not serving your body. It also works, again, like I said, with calming down the nervous system, getting your natural endorphins going, working with balancing the hormones. As we talked about before, when one hormone is off, all the other hormones can be off as the body tries to compensate that. And it also works with helping with the follicle, as far as how big it gets, as far as the quality of the follicles, and also working with the lining of the uterus and getting that thick enough for implantation. We want our clients to get to their goal as quickly as we can make that happen. Now, it can be a slow process, so that can be very stressful, sometimes frustrating. So that's where the support system of your practitioner comes in, and throwing all these other options out there, not to stress the patient out, but to give them the hope that they know there are other things we can look at, and there are other things we can look at together as a team, getting their doctor involved, getting their husband involved. He may not have a motility or a morphology or count problem, but there may be herbs he can be taking just to help, even though his count is at an okay count or just on the threshold of being too low, we can make that higher. We can help make that higher. I should say we can make that higher. It can be effective for people. But a lot of times when the partner comes in to help in that way, even just taking herbs, it makes them feel more like they're not doing everything alone. And it makes them feel like they're doing something together. And I think a lot of times it gets lost where the husband or the partner who's not trying to conceive and carry the baby kind of feels helpless and doesn't know what they can do to help. And kind of when you feel like you're in this together, you're taking your herbs, I'm doing my acupuncture, we're going to talk about these other issues, we're going to rule out what could be possibilities of problems instead of flying blindly through and just trying every month and getting a negative. It creates a much better environment for the patient.
Lovely. I really like that. Working as partners together, helping both the male and female partners, helping the Western medicine side of things, supporting and supplementing not just what's needed to get pregnant, but also maintain that pregnancy and speed up the labor process. All amazing words, all good things. We're so grateful that you gave us this time and helped explain this. I'm already at ease just thinking about it. We love your baby board and we wish you most success. We hope we grow more pictures on that baby board.
Oh, we will. We'll keep doing it.
Thank you, Jen. Appreciate your time.
Thank you.